to wash my hands. I'm going to introduce myself. Hello, I'm Jennifer Anderson. I am a nursing student from the College of Nursing, and I'm going to do a head and neck assessment on you today, if that's okay. All right, so the first thing I'm going to do is I'm going to look at your head. Your head is normal cephalic. I notice that your eyes, your nose, your nasolabial folds, your lips, your ears, they are all symmetrical and equal. The next thing I'm going to do is assess your hair. Do you mind taking off your hat for me real quick? All right, so your hair is brown. It is clean. I do not see any pest infestations, which is good. So would you bend down just a little? Since I'm short, I'm just going to palpate your scalp. All right, so I might feel a little bump back here. Yeah, I do.
Is that good or bad?
Is that, have you always had that?
I have.
Okay. All right, so I did feel one little bump, but other than that, you put your hat back on, thank you. I did not feel any kind of lesions, abnormalities whatsoever. So the next thing I'm going to do is I'm going to assess cranial nerve number 5. That is a trigeminal nerve. So what I want you to do, I would like for you to close your eyes. I'm going to touch your face real lightly in 3 spots, and I want you to tell me when you can feel it. Okay. All right. So then what I'd like for you to do is I'd like for you to clench your teeth and bite down. Okay, I'm going to palpate. All right, so good muscle strength and resist me opening. Perfect. So cranial nerve number 5, the trigeminal nerve is intact. So next we're going to do cranial nerve number 7, which is the facial nerve. So I want you to make a lot of funny faces for me. So you're going to, can you smile? Frown? Puff out your cheeks? Can you raise your eyelids? Right, there you go. Now will you close your eyes? Now will you prevent me from opening them? Perfect. So your motor part of cranial nerve number 7 is intact. Now for the sensory portion, normally I would place something salty or sweet on the anterior 2/3 of your tongue, get you to identify it, but I'm not going to do that today. So now I'm going to move on to your eyes. Okay, so your bulbar conjunctiva, it is clear. I'm going to pull down your lower lids with my thumbs. Your palpebral conjunctiva is also clear. Your eyebrows, your eyelashes, your eyelids, they are all present. They are symmetrical. Your eyelids overlie the limbus and your eyelashes fan outward. And I do not see any presence of ptosis, and your sclera is white without any jaundice or any redness. So now I'm going to do what's called Perlac. So if you'll just kind of look up. So your pupils are approximately 8 millimeters. They are equal, they are round. Now I'm going to check for pupillary light reflex. So the first thing I'm going to do is called direct pupillary light reflex. So what that means is I shine the light directly in your left eye, and that eye constricted. Now I'm going to come back, and I'm going to look at this eye for consensual pupillary light reflex, and it also constricted. So now I'm going to test for accommodation. So would you please look at the exit sign up there? Okay, so your pupils dilated. Now look at my pen light. Your pupils constricted. Now follow it in towards your nose. Perfect. So your eyes turned in on their axis, and they converged. So that means that your pupils were equal, round, reactive to light. They accommodate and converge. All right, so now what I'm going to do is test for some muscle strength with your eyes. So the first thing I'm going to do is called the 6 cardinal positions of gaze. So what I need you to do, I want you to follow my pen light with just your eyes and not your face. Okay, so parallel tracking was noted with no nystagmus. So that means that 3 cranial nerves were intact. That was the 3 is the ocular motor, 4 is the trochlear, and 6 is the abducens. So now I'm going to do the corneal light reflex test. Okay, you look straight ahead. So the light shined in the same spot on bilateral cornea, so there was no deviation in the axes of the eyes. So now what I'm going to do is I'm going to check your visual acuity. So first off, what I would normally do is I would have a Snellen eye chart on the wall. I would ask you to stand 20 feet away from it, cover one eye, and I'd ask you to read the lowest line that you could read. But I don't have that today. But what I do have is a handheld pocket screener. I'm going to get you to hold it 14 inches in front of your face, or actually I'll just hold it, and you're going to cover one eye and read the lowest line possible, okay? All right, so cover one eye, and then read the lowest line possible.
Like numbers?
Yep.
4, 2, 8, 7, 3, 9.
Show me what you got. Okay, so you have 20/20 vision, so that is the gold standard. Now, if you had had something like 20/50, that would mean that you could see at 20 feet what the normal eye could see at 50 feet. So now, and I would normally do that bilateral, but I'm just gonna do one for today. So now what I'm going to do is move on to your ears. So I'm gonna palpate your ears, and if you feel any pain or tenderness, let me know. So sorry, my hands are cold. All right, so this is the helix, the anti-helix, the anti-tragus, the tragus, the lobule, and your external auditory meatus. I do not see any redness or drainage. You do not have any piercing. There's no abnormalities. Did you feel any pain or tenderness? Okay, and I'm only going to do these. I'm not going to do these bilaterally, but normally I would as far as palpating. But what I am going to do is I'm going to check your hearing. So I'm going to do a whisper test, so I need you to cover one ear. I'm going to whisper a word, and I want you to identify it. Right. Okay, so cover the other ear. Okay, perfect. So he was able to identify both of my whispered words, so that tells me that you have no high frequency hearing loss. The next thing I'm going to do is I'm going to check your nose. So I'm going to palpate your nose. Do you feel any pain or tenderness? So your nose is midline, there's no deformities. Both of your nares are symmetrical. I'm going to look up in your nares. Everybody's going to blow their nose before they come to class. All right, so your nasal mucosa is pink and moist. Both of your, there's no septal deviation. I think I do see your turbinate on this side. And I do not see the turbinate on the other side. So turbinates are a beefy red in color. I believe I did see it on the right, but was unable to see it on the left. So now what I'm going to do is test cranial nerve number 1, the olfactory nerve. So first I want you to take and occlude one of your nares and sniff in and out. Okay, and do the opposite. Okay, so both nares are patent. So what I want you to do now is I want you to close your eyes, cover one nostril, and I'm going to give you a scent and see if you can identify it. I only have one, so. All right, can you smell it?
Yeah.
What is it?
Hand gel.
That's right. So now, just for the fun of it, close your eyes, cover the other nair, so we have to do both sides. So once again, we'll pretend this is new, but what do you smell?
Hand gel.
Okay, perfect. So you correctly identified both scents, which it should be 2 different scents for you all's purposes. So cranial nerve number 1 is intact. So next we are going to move into your mouth. So the first thing I'm going to do is I'm going to note that your lips, they're pink. They might be a little dry. And so now open your mouth. Buccal mucosa is pink and moist. Your tongue is midline. It is also pink. Can I go like this? Okay, so your gums, they are pink in color. There's tight margins. There's no evidence of gingivitis. Have you had any teeth removed?
No.
Okay. Even you have a wisdom teeth? You don't have your wisdom teeth?
No, I do have them.
Okay, so you should have 32 teeth. So if you'll open your mouth again for me. So 32 teeth, your teeth are white, they're clean, you have good dental hygiene. Your hard palate is anterior to the soft palate, it's white. Your soft palate is pink, posterior to the hard palate. Can you go, ah, and try to flatten your tongue? Okay, your uvula road with phonation, and you do have your tonsils, right?
Yeah.
Okay, yeah, you do. I'm pretty sure I saw them, but you're taller than me. So look down just a little and ah again. Yes, perfect. So your tonsils are roughly approximately a 2. So now what we're going to do is I'm going to palpate all your lymph nodes. And what I need you to do is to tell me if you feel any pain or tenderness. So This is the preauricular, postauricular, occipital, submandibular, submental, tonsillar, superficial cervical, okay, posterior cervical. Okay, now I'm going to do the deep cervical, but I'm going to kind of pinch your muscle right here and get real deep behind. I do think I palpate a lymph node right here. So that is a palpable lymph node. Okay, and if you will hunch your shoulders, this is the supraclavicular. Did you feel any pain or tenderness? Okay, so one of your lymph nodes was palpable here, kind of in the posterior cervical area. Lastly, I'm going to do cranial nerve number 11. That's the spinal accessory nerve. So what I need you to do is to shrug your shoulders and prevent me from pushing them down. And then I want you to turn your head and then prevent me from pushing it back, and then do the opposite. All right, great. So cranial nerve number 11, the spinal accessory nerve is intact, and that completes my head and neck assessment. Thank you very much. All right, so let me check